Assalamu alaikum dear students. I'm here again to teach you the third molars which are left. We have studied all the other molars. I was in during the last day, so I couldn't post the lectures. So we'll start with the third molars which are quite easy. Here we go. So the initiation of calcification in third molar starts at 7 to 9 years of age. So we cannot see the tooth bud before the tooth bud of the third molar before this age. So the third molars initiation of calcification जो है वो 7 to 9 years of age में start होती है, and then the enamel completion takes place 12 to 16 years of age. And we can see the eruption in the oral cavity at 17 to 21 years of age. And there's lots of variation occurs in the eruption of this in the eruption age of this third molars. So I have told you in my first presentation, these are also called the wisdom tooth, which appears in the age of an individual when he has a good sense of good and bad. So we call it a wisdom tooth. The laymen call it a wisdom tooth, अक्ल दाढ़ जिसे कहते हैं. ठीक है. The completion of root takes place 2 to 3 years after the eruption of the third molar, that is 19 to 25 years of age, right? The third molars, maxillary third molars and mandibular third molars, both have mesial contact with the mandibular and maxillary second molars. They are non-succedaneous teeth. As you all know, the molars are all non-succedaneous, and they have got no distal contact. And mandibular teeth, वही इसमें difference होगा. The mesiodistal width of the mandibular teeth is more than the buccolingual width, and the maxillary third molars has got more buccolingual dimension than the mesiodistal dimension, right? And they are the most variable teeth, and among the molars they are the smallest of all, and they are very variable in the terms of crown and in the terms of root morphology, right? And if you see in the surgery, there are much more common cases of impacted third molars, and they extract and you can see the variability among the crown and root of the third molars. Very interesting cases comes in surgery in which we can see the different roots. There you can see the root could be fused, there could be 3 roots, there could be 4 roots present there. Similarly, in the crown we can see the different morphology of crown. They are in the maxillary molar. The more common is the heart shaped and the rhomboidal shape, and they could be as small as a peck shaped. We can see the peck shaped molar in case of third molars, right? So they are smaller in dimension, most variable tooth, and they have got heart shaped, more common, and the distolingual groove could be absent in the maxillary third molar. There could be, if it's rhomboidal in shape, the distolingual cusp could be present, but there will be no oblique ridge present in the third molars. ठीक है. Oblique ridge जो है उसमें absent होती है, and there is variability extends from peck shaped smallest crown to the large shaped crown. ठीक है. And there could be the variability in the roots. There could be 6 roots present, 5 roots present, 3 roots are commonly found in the maxillary third molar. So here we can see the different views of the maxillary third molar. We can see there is a distolingual cusp. This is the distolingual cusp, distobuccal cusp, which is smaller than this mesiobuccal cusp, right, on the buccal aspect. From this we can distinguish the quadrant of the third molars. ठीक है, it's right or left we can determine by this distobuccal cusp, right? So this is the distobuccal cusp, which is smaller than the mesiobuccal cusp, right? And it is the smallest tooth, and it has only one antagonist in the mandibular arch, and the other tooth, that is the smallest central incisor, mandibular central incisor, which also has one antagonist in the opposing arch, and these are the only two teeth which has got only single antagonist in the opposing arch. All of the other teeth have got two antagonists. ठीक है, we can see the root morphology, which are the roots. It also has got three roots like other maxillary molars, and the three roots are in close approximation, or they may be fused together. Here you can see the roots are fused together, and the roots could be partially or completely fused together. And we can see the occlusal surface where we can see that more supplemental grooves are present in case of heart shaped and rhomboidal both, right? And these supplemental grooves are present. Here we can see the morphologies of heart shape, which is commonly present, and the rhomboidal shape is also common. The root crown morphology, as I have told you, the third molars are most variable tooth, and clinically, if they are sound and they get the space to erupt in the oral cavity, they can be used as an abutment tooth in case of prosthesis. जैसे prosthetic में हम लोग bridges वगैरह लगाते हैं. So if one individual is lucky to have that the sound third molars, they can be used in the orthodontic and the prosthetic point of view. These third molars can be utilized, right? And there are impaction is very common, as you all must have been aware of it. हो सकता है काफ़ी लोगों ने आप लोगों में impaction कराई भी हो, extract कराया हो तो ठीक है. So इसमें ये क्या if the tooth does not get the space to erupt, so they get impacted, or they are unerupted in the oral cavity. There could be a hindrance like bone or soft tissue could be present, which hinder the eruption of this third molar. Now today we will study, now we come to study the mandibular third molars. Third molars, as you all, I have taught you the chronology of the maxillary third molars. There is a little bit difference of 1 or 2 years between the chronology of the mandibular third molar and maxillary third molar. So the eruption is timing is same, 18 to 21 years. The eruption timing is same for the mandibular third one, that is 18 to 25 years of age. The 17 to 21 years of age, and the root completion takes place between 18 to 25 years of age. And these mandibular third molars also it has two types like that of maxillary third molar. One type is same as of the mandibular second molar, that is four cuspid, and the type 2 is 5 cuspid, that is similar to mandibular first molar, जिसमें हमने 5 cusps को पढ़ा था, that all were functional. Or same, the type 1 is the second molar, which you have recently taught. Dr. Jamil has taught you very well. That is 4 cuspid of mandibular second molar. It has got more secondary grooves that is present on the occlusal surface of the mandibular third molar. So sometimes we call it a crenulated surface, that it has got a wrinkled appearance. In the maxillary third molar, it also I've taught you, it also has the same more supplemental grooves. Sometimes it is difficult to differentiate is from the primary grooves. There is two roots commonly present. Sometimes they are fused together, and they are deflected towards the distal surface. They are deflected towards the distal direction. So you have to differentiate the quadrant between among the third molars is a bit difficult. So there is buccolingual dimension is more on the mesial surface than on the distal surface. Mesial surface पे buccolingual dimension ज़्यादा होती है as compared to distal surface, from which you will be able to differentiate the quadrant side of the mandibular third molar. The mandibular third molar are highly variable tooth in which there is a variability present between the cusps and the roots of the mandibular third molar. The cusp can vary 4 to 5 in number. Yeah, it can also vary to up to the 6 cusps number, and the roots are also I have recently did a research on the third molars in which the roots vary up to 6. I have myself noticed the 6 number of roots in the third molars. As the cusps varies, there is different groove pattern and fissure pattern present in the mandibular third molars. Where there is an odd number of cusps, there is a different type of groove pattern, like it has zigzag pattern. You can see here this is a different groove pattern, and in the 4 number of cusp we have got the same second molar wala pattern hota hai, that is a plus shaped groove pattern is present. When the cusps number increases, the groove pattern changes itself, right? So there are different groove pattern present as the cusps variability takes place. The variability in the cusps takes place. So there is in the crown morphology different groove pattern is present, different number of cusps is present, and the mesial buccolingual dimension is more than the distal buccolingual dimension, right? So the roots are highly variable in the mandibular third molar. The number of the roots, as you can see, there is abnormal curvature could be present in the mandibular third molars, like it has more distal curvature, or could be fused together. The roots are fused together. There could be increase in the number of roots, increase in the there could be accessory canals are commonly found in the mandibular third molar. There is highly variation present in the roots of the mandibular third molars. Okay, and the length is commonly the third molars have got less length as compared to other molars in the oral cavity. This is a diagram representing the different views of the mandibular third molar. Here we can see this diagram. I have taken it from Margaret J. This diagram, you can see more supplemental groove is present. There is the mesial cusps are larger in size than the distal cusps, right? These are the mesial cusps. These are the mesial cusps which are larger in dimension than the distal cusps, right? And we can, from this view, we can differentiate the quadrant side of the mandibular third molar. Here you can see the fused roots. The two roots are present which are fused together, and they have got a distal deflection in their roots, the abnormal distal deflection. Here we can see this type is the type 1 Consi type. Here type 1 is the four cuspal type, in which is similar to mandibular second molar, type 1. Okay, and the type 2 is the 5 cuspal type, in which there is a distal cusp present like the mandibular first molar. Here it is more upright. The mandibular molars are more upright, and which is opposite to the antagonist, which is the maxillary are more toward the buccal side, right? And if the molars are sound and the person is lucky to have a sound third molar, they can be used as an abutment or for orthodontic purpose. Here we can see the root comparison of the mandibular, the crown root and crown comparison of mandibular third molar and the mandibular second molar. So this is a diagrammatic in which there is a fused roots, there is a difference between the crowns of the roots, and the distal area of the mandibular third molars is the area of supernumerary molars, which can be present on the distal aspects of the mandibular third molar. But the supernumerary tooth is hardly found these days, as we don't have the third molar doesn't get the space to erupt in its proper place. So supernumerary teeth are can be present in some people, but it's hard to find the supernumerary fourth molar, which is present on the distal aspect of the mandibular third molar. The agenesis of the third molar is commonly found, in which the third molars are missing. The people don't have is congenitally missing, and the third molar tooth bud is not found in the oral cavity of the many individual. 25% of the population does not have third molars in their oral cavity, and it can be revealed in the radiograph of the or the OPGs of the patients in which the third molars are commonly missing. So the anomalies of the third molars, they are congenitally missing. Agenesis of third molar takes place, they are impacted. Here you can see in the picture there's a soft tissue covering the occlusal surface of the this third molar. Here you can see this is the gingival covering the occlusal surface of the third molar, and it causes the hindrance of this third molar to erupt in the oral cavity, and we call it operculum. The third molars are difficult to clean, and they are commonly carious, as we don't get access to clean the third molars on the distal aspect, and there are many periodontal problems present in the third molar. The supernumerary tooth का जो मैंने आपको बताया है, this is the area where supernumerary tooth can be present. That's which is the fourth molar, which is not commonly found, but this is the area where the supernumerary tooth can be present. Now this is a very good diagram of an impacted tooth. Here you can see the third molar, which is causing much problem to the other molars as well. This is a third molar which is in a big problem. It does not has the space to erupt in the oral cavity. Maybe the jaw size is less, or there could be soft tissue hindrance, and it is positioned against the other tooth like this is positioned against the other tooth or alveolar bone, which causes the hindrance to erupt this third molar into the oral cavity. And if this occurs, it may causes damage to this neighboring tooth, and it also causes the बाज़ लोग पेशेंट्स आते हैं कि हमें इस दांत में सेकेंड मोलर में तकलीफ है. होता क्या है, देयर इज अ थर्ड मोलर which is causing constant pressure on the second molar, and the pain occurs and patient cannot recognize where it comes from. So वो कहते हैं कि पीछे के दांतों में मेरा जो है दर्द है, and it is very painful condition. बाज़ दफ़ा and when it occurs, it is necessary to get surgical removal of this third molars. ठीक है, and if it does not occur, it will cause bone resorption. It will make other pathological problem to the adjacent teeth. Here we can see the different impactions in this radiograph. There is mandibular and maxillary third molar, which is obvious. These are the maxillary third molar, and this is the mandibular third molar, which are which are impacted, and they don't get the space to erupt in the oral cavity, and it is causing the if it does not, it needs a surgical removal, otherwise it will cause problem to the bone and the adjacent tooth. Okay, so there is this is an example of impaction, and there could be congenital, it could be congenitally missing कि ये जो है आपका these tooth buds are not present, these are not revealed in the diagram, these third molars. So the third molars will be missing in the radiograph, and the person will have congenitally missing third molars. ठीक है. Here is a this is the diagram in which the third molars are in close approximation with the inferior alveolar nerve. Here you can see, and it may cause the problem to the uh, it may cause the problem in the surgical removal of these third molars. Okay, and it will impinge this the inferior alveolar nerve and will cause much pain in these patients, and it causes much pain in these patients, right? So this was all about the impaction and the anomalies of third molars. I have discussed the morphology with you. I hope you guys understand it. After a long time, I recorded this lecture, and I'm feeling very good about it. After a long illness, that I'm able to record my lecture for you guys. So I hope you guys are getting my points. Now we will move towards the in which I will show you the uh, extracted third molars. These are the third molars which I have collected from the surgery department, and here you can see the different variation in the crowns and roots of the third molar. Here you can see the crown, abnormal number of the these cusps and the roots. Some of them are fused together, some are smaller, and some have got abnormal number of roots. So the third molars are extremely variable. As I have taught you, they have got wrinkled appearance, or many supplemental groups are present. Here I have observed it in different extracted teeth. So you guys, if you guys are interested, you can also go, and you can also do a research on these third molars, on the morphology of the third molar, different number of cusps and groove patterns you can study in the on the extracted tooth on the third molar. So if you anybody is interested in the research of third molars, they can contact me, and we will do a research on the third molars, right? Thank you. Thanks you guys. Now our morphology is almost finished, only anomalies are left, and I will tell you about the gross differences about between the deciduous and permanent teeth, right?